Alright, so this video is a demonstration of a postpartum exam with most of it's just a general exam, and then there will be a couple elements for the 6-week postpartum. So I will begin by checking in with the family and saying, how have things been since I last saw you?
Good.
Good. How has bonding with baby and nursing been going for you?
Going well?
Yeah. Do you feel like your milk has come in and everything feels good that way?
Yes.
Okay. At the end, towards the end of the exam, when we want to check your bottom to see how you're healing, I'm also going to have you nurse for me, and I can just make sure the latch looks good and everything for that. How have you been feeling emotionally?
Good.
Good. No troubles with any postpartum depression? Do you happen to have that paper that I left with you last time?
Did you
get a chance to fill that out?
Yep.
Great. So this would be the Edinburgh exam, postpartum exam that I would, or assessment that I would leave with the clients and let them do on their own time, and then just assess it when I am with them. So I'd look over it, see what their score is. Looks good, doesn't look concerning at all. If it did look concerning, this would be the time that I would kind of talk to them about that, how their emotions are, and refer them if they need to a psychiatrist or psychologist for talking, or any other kind of counselor. But we'll go with that was a normal score. So, how has your bowel movements and your voiding been? Anything unusual there?
Nope, that's good.
Okay. And your bleeding, has that stopped? Is it still a little spotty, or?
It stopped.
Okay, that's great too. I want to do your vitals now, just like we normally do. So I'll have you take your temperature while I get your blood pressure. We'll set Hazel over here. Just have you rest your arm on that. And I'll watch it to see when it's done. Okay, that looks good. And that is good, 120/60. No, it's beeping because it's low. Alright, and then I'm just going to check your pulse really quick. So everything looks good and your bleeding has stopped. Have you had, this is your first baby, so I wouldn't expect you to have any after pains, but have you had any cramping?
No.
Okay. And then how has your rest been with baby, and how is your family being supportive, and you feel like you've got a good support system with you?
Yep, we've been good.
Great. So before I have you undress and we do the examine your bottom and check your belly and stuff, do you have any other questions for me?
Yeah, I was wondering what type of birth control I can use right now.
Okay. So you are exclusively breastfeeding, correct?
Yes.
So with breastfeeding, we don't want to do any hormonal birth controls. I do have a piece of paper, a little handout that I can give you. And here it says all non-hormonal options are safe for breastfeeding. So right now we want to do that. If you're exclusively breastfeeding, for the first 6 months, that's a pretty good form of birth control. After that, we'd probably want to look into something else. If you're a little bit more cautious, you can also use condoms or track your fertility, except that's a little bit more difficult since you're immediately postpartum. Or another really great option is the copper IUD, which is non-hormonal and can last for up to 12 years and can be completely free if your insurance covers it. After, if you're no longer exclusively breastfeeding, or after 6 months, and if you're interested in looking into hormonal options, we have these, and we can look into that, and you can always reach out to me even after 6 weeks to check in about that if you'd like. So I'll leave this with you, and then I'm just going to step out of the room and have you get undressed so that we can do the vaginal exam, check your abdomen and see where your uterus is at, and then I'll have you do the breastfeeding if she's hungry. Okay. So then you go ahead and get up and let's do this. Here's Mom. Right, you go. Okay. While I stepped out, I have washed my hands so that they are clean, and I would put on sterile gloves. I would not crawl over the client like this, but put on sterile gloves and have a sterile lube with me so that I can do the vaginal exam. She's got her robe on. We've got baby right next to us, and I would just open it up, check, have some good lighting so that I can see if there's any hematomas, any sort of, if there was a laceration, I would check, see how that healing is, any abnormal discharge from the wound or just vaginally at all, and just seeing how things look down there. And if there's any tenderness, might do an internal just to see how everything is feeling in there. If there was a laceration, it could be more deep. I'd feel all the way through just to see how things are going and know if she reports any tenderness. After that, I would get rid of this glove, put on new gloves, or just my bare hands since they're clean, if she's all right with that, to check her uterus to see if it's completely involuted, and then starting kind of at her belly button, but I would not expect it to be there at like a 6-week appointment, but just feeling my way down. And then if I can't feel a uterus, the fundus at the before I hit the pubic bone, then that's great. That means she's completely back to where she should be. If it's a little bit earlier in the postpartum period, I'd want to measure and see how many finger breadths below the umbilicus she is, and check back with how many days postpartum we are. After that, I want to check for diastasis, recti, having her kind of do a crunch and seeing how her ab muscles move together in a few different spots. And then just overall feeling and asking her if she has any tenderness anywhere in her bottom. After that examination, I'd want to just watch mom and baby breastfeed, and then looking at latch, listening to hear if there's any clicking or concerns in that way. Seeing if there's movement, I like to look by the ear to see if that jaw movement's really going, and if there's a nice deep latch, and seeing if there's any nipple pain and if mom's nipples are cracked at all, and any other concerns that she might have regarding breastfeeding. Other than that, I would just make sure that after we have checked over everything, if there's something that she has concerns about, she wants to check in with me on, and that's about it. Making sure that everybody is good and settled. She's getting enough rest. Her family is supporting her. She is getting still those good quality foods, eating a healthy diet so that she can both heal and support her and baby. And if this is our last appointment, I would wish them the very best and let them know that they are discharged from care, but if they do have questions or something, and they need a reference to somewhere, like a doctor's reference, or where to go if she does all of a sudden develop a postpartum issue, that I am free and available to give them that reference. So that would be my postpartum exam.